नमस्कार, मैं डॉक्टर रंजना बेगन, कंसल्टेंट ऑब्स्टेट्रिशियन गायनेकोलॉजिस्ट, मणिपाल हॉस्पिटल गाज़ियाबाद से। आज मैं फिर से आपके सामने बात करूंगी हाई रिस्क प्रेगनेंसीज़ के बारे में। आज हमारा टॉपिक होगा जेस्टेशनल डायबिटीज़। जेस्टेशनल डायबिटीज़ यानी कि डायबिटीज़, ब्लड शुगर लेवल्स जो बढ़े हुए हैं, you discovered during pregnancy, and before that you thought you were always non-diabetic or you were non-diabetic before conceiving. So any diabetes or raised blood sugar levels which appear once you are pregnant are going to be defined as gestational diabetes. What is the cause of gestational diabetes? The researchers till date do not know what causes gestational diabetes. We can only थिंक अबाउट सर्टन रिस्क फैक्टर्स जिसकी वजह से आपको प्रेगनेंसी के दौरान डायबिटीज़ हो सकती है। एंड व्हाट आर दोज रिस्क फैक्टर्स? दोज रिस्क फैक्टर्स कैन बी योर हाई वेट, ओबेसिटी. ओबेसिटी इज़ द फर्स्ट एंड foremost रिस्क फैक्टर ऑफ जेस्टेशनल डायबिटीज़. ऑल्दो ऐसा नहीं है कि लीन एंड थिन पेशेंट्स को जेस्टेशनल डायबिटीज़ नहीं हो सकती, लेकिन पेशेंट्स या लेडीज़ हु आर प्रेग्नेंट बट विद हायर वेट आर गोइंग टू हैव chances of gestational diabetes more than the ladies who are thin or normal weight. Second risk factor can be your inactivity, sedentary lifestyle. Third would be any history of polycystic ovarian syndrome during your adolescence or before pregnancy. Next cause would be any history of family history of diabetes in your family. Any genetic history of diabetes predisposes you at a higher risk to develop gestational diabetes. The other factors can include a previous childbirth of weight more than 4 kilograms or any history of previous diabetes mellitus. So why do we risk gestational diabetes as a complication? We term this as a complication or high risk for certain reason. There are reasons which are pertaining to your baby and there can be reasons pertaining to yourself. The high risk for the babies would be a very big size baby or the baby with early delivery. The complication of diabetes for your baby would be early delivery. You can go into preterm labor. A baby is so big in size that you have to be delivered early. The diabetes can also lead to a big size baby, which can lead to early juvenile diabetes in young adults. This child can grow up to be a person with type 2 diabetes also. And above all, because of a large size baby or a big size baby, you have to undergo a cesarean section delivery. And the complications for yourself would be a retained diabetes. That is, you may have gestational diabetes, but after delivery you might not get rid of the diabetes until and unless you lose a lot of weight and take medications and take good care of yourself. Secondly, because of a big size baby, you might need to undergo cesarean section, or because of diabetic complications or uncontrolled blood sugar levels, you might need to have an early preterm delivery, maybe normal or cesarean, but the pregnancy need to be terminated early. Then there might be respiratory problems for the baby. Uncontrolled diabetes can lead to very big complications, like you can end up, God forbid, with a stillbirth where you deliver normally but the baby still doesn't breathe, or maybe you deliver by cesarean section and the baby doesn't breathe. The stillbirth pregnancy is the biggest threat to pregnancy with gestational diabetes, and I think any pregnancy should be very closely monitored by your obstetrician, especially if you are having uncontrolled diabetes or you are showing blood sugar levels which are not normal or are not being controlled with diet and exercises, and you will need to be put on medications. So please do remain under your doctor's care throughout your pregnancy and keep a close watch that you don't develop blood sugar levels at any given point of time which are beyond the normal range. Thank you.